with you today. I'm Dr. Rehab Ahmed, internal medicine specialist at Medcare Hospitals. Today we will discuss issue regarding anemia. I hope to be good for you and to know good information from this issue today. We have our marketing team, Ms. Ahdeya, with us. I will invite you to share us.
Thank you very much, doctor. Yes, doctor, we start the topic as you mentioned, like anemia, we will talk today. I want to first of all apologize that we start a bit late as we had some emergency to fix it. So still technical issues happening, and I hope that we'll fix everything in a couple of seconds. So yeah, it was beautiful. Okay, so the topic will be today with Dr. Rehab. She's our internal medicine doctor about anemia, as we discussed earlier. And here's a couple of questions we were coming up with our followers and viewers asked before, and now we want to share some of them. And if you have any questions you want to ask in Arabic or English, I think Dr. Rehab can answer all of them. So, doctor, what is anemia itself?
I want to explain anemia in simple way for all of people watching us now. Anemia simply it's a defect in loss of hemoglobin, less hemoglobin in your blood, less RBCs in your blood. What is the function of RBCs in our blood? Its main function to transfer oxygen from tissue, from lung to tissue, and transfer carbon dioxide from tissue to the lung. So for gas transfer, it is important and crucial role in our body. So if RBCs decrease in our body, it will cause anemia.
Okay.
Actually, this is a simple explanation for anemia.
Okay, doctor, is there any type of anemias, or maybe there is some explanation about type of them?
Yeah, actually anemia is a big subject. We can simply say that is anemia. We said before it is less RBCs. RBCs, what will cause less of RBCs? If we lose it through bleeding, for example, loss of RBCs will cause anemia.
Okay.
Or destruction of RBCs will cause anemia.
Okay.
Or less production from main factory, it will cause anemia.
Okay.
So this is the main types of anemia. And under these types, there is subtypes.
Okay.
Actually. So this is main causes of anemia, as we mentioned. And under this, we can, regarding muscle production of RBCs, it will be problem in factory itself, bone marrow, because bone marrow is responsible for production of our RBCs.
Okay.
So if there is problem in bone marrow, it will cause anemia.
Okay.
There is problem in the production of RBCs itself, or component of RBCs itself.
Okay.
If there is vitamin deficiency, like iron, vitamin B12, or folate, or loss of RBCs, as we mentioned, through bleeding,
okay,
it will cause anemia, or destruction of RBCs itself. It will be destructed,
okay,
and destroyed faster than replaced by bone marrow itself, because usually RBCs lifespan 120 days. If destroyed before this and faster than replaced by bone marrow, it will cause anemia.
Okay.
There is a lot of causes طبعا for destruction of RBCs, mainly genetic, like hemolytic anemia.
Okay, so it means that we have genetic issues in case if there is
a lot of genetic issues. Actually.
That's good to know, because like there's a lot of factors, like you mentioned, of sometimes we're getting pregnant. I mean that women most of the time, and they're coming with anemia.
Because there is risk factor also for anemia.
Okay.
There is types and risk factor who's more common to have anemia.
Okay.
Mostly, as you mentioned, pregnant woman. More commonly, if she deficient in multivitamin taking, she will develop anemia.
Okay.
All women actually, they are risk factor for anemia because they lose blood every month in menstruation, so they are at risk for anemia. Okay. If somebody have chronic disease like liver, kidney, cancers, will cause anemia also. Old age, more than 65, is a risk factor for anemia. Okay. So there is risk factor and there is causes. So to be careful.
Okay, that's good to know, because like we're living in very I mean that the stressful lifestyle, the food we're eating, the life we're living now, everything I think can be one of the causes. But I think there is a main we have a question here. I just want to go back to our followers because there is a question on social media that we talked about the factors and we didn't mention kind of symptoms. So they're asking that what kind of symptoms we can have while we have anemia. Yes.
Yeah, it's very important to see what I have to be suspect anemia, to be I suspect to be I am anemic or not. There is common symptoms for all types of anemia, and there is specific symptoms for specific types of anemia. As we mentioned, there's a lot of types. So main symptoms for all anemia, like fatigue. If you feel all the time you are fatigued, tired, weak, this is most common symptoms actually. And heartbeat, you will feel your heartbeat more, like palpitation, yes, or irregular, causing arrhythmia. Sometimes chest pain. Shortness of breath, you can take your breathing properly. All this is a common symptoms for anemia for all types. Another types, all types, but another specific types, they have a specific symptoms for each type actually. And there is also, we have to take care of about this is acute anemia or it's chronic. More anemia will more symptoms and we can feel it.
Okay, as I understand, doctor, like the symptoms is more common, not common. I mean that it's similar to some
other
flu, headaches, just stress time. Like this is like how we have to understand, or it's need to be visit doctor to check what's.
If you feel always fatigue, as you told now, as you tell us now, that is common with another diseases actually. But also for anemia, you will feel that you are pale, more weak. You have to see by your doctor if you feel these symptoms more with palpitation, always you have being dizzy, if you got doing any sample job, you will feel tired and weak. So you have to visit doctor and to see and to diagnose what is
because of those.
Because also anemia, it's like fever. We have to investigate.
We mentioned one of factors can be it's our food we're eating daily. Maybe you can explain us a bit about what kind of food, and as well there is a food which have iron. I mean, in itself, like that chemical part.
One of types of anemia we mentioned production of RBCs. There is a problem in factory itself, bone marrow, or deficient of component of RBCs. It's a vitamin deficiency. Raw material to produce RBCs. The main raw material for RBCs, it's iron. This is the main, because it's a heme from iron and globin protein. So it's the main component of RBCs. If deficient in iron, it will be anemia. Iron deficiency anemia is the most common cause of anemia actually. And vitamin B12 also, this is important component of RBCs production, and folic acid. So if deficient in these vitamins, we will develop anemia. Iron, we will find iron in a lot of food actually, like dark green leafy vegetables, dried fruits, meat, beans. This is all high in iron. And it's better also to combine with high vitamin C because it helps absorption of iron. Like citrus juices, broccoli, tomato, lemon. It will help more absorption of iron. Vitamin B12 we can find more in meat, dairy products. Folic acid we can find in beans, kidney-shaped beans, rice, cereals. We can find folic acid.
That's good. What I understand that in case if we have we're visiting a doctor, right? So when we're visiting a doctor, beside all the treatment you're writing, like medication, you're giving any diets, including all those food like products you mentioned now, or what kind of diet can be followed up by the patient?
Regarding to the severity of anemia, if it's mild, moderate, severe, and the cause also, I have to define what the cause. Before it's anemia, the symptoms for another thing. So I have to treat the cause itself. If there is blood loss, I have to stop these blood loss. If there is vitamin deficiency, we have to follow diet full of iron, vitamin B12, folate, and the vitamin C to increase absorption. And some people also, there is a deficient in absorption of vitamin B12. It will be genetic. There is deficient in factor responsible for vitamin B12 absorption. So they depend on vitamin B12 shots actually. Not they will not benefit from oral. So according to the cause, we can manage. And if there is more iron loss, more low iron in the blood, we have to replace it with medication beside diet.
Okay, that's good. So we have here a question, and by the way, I want to thank so much all our followers and viewers today for being active and asking questions. As I mentioned that we're receiving now questions in English language, but you can ask as well in Arabic, and I'm sure that Dr. Rahab can answer in Arabic too. Sure. So as we mentioned earlier, like the food and the stress and pregnancy and those things, right? If we're taking care, if we have someone in our house, what you can suggest them, like the family or the people who is around those people who has anemia, the first aid help or maybe medication which can have at our house, or just to help those people. And is there any follow up? I mean that if the patient has anemia and khalas, he's in the process of being weak and things, is there any danger part which we need to predict before something that will happen?
If you have a patient with anemia and already diagnosed what's the cause, and we start treatment for the patient, for example iron deficiency anemia, and we start already replacement for iron, we have to stop another thing that interfere with absorption of iron, like coffee and tea, for example, to interfere. Like also if there is any blood loss, we have even little bit blood loss through gastritis, simple cause. A lot of people have gastritis from over-counter drugs. We can take it as analgesia, aspirin and other analgesia. It will cause gastritis. It will tiny bleeding. We will not notice, and it will cause loss of RBCs and loss of iron stores. So we have to take care of this issue, because if I give replacement, I will lose it again, and I will not treat my anemia. So we have to be care of that. If patient have blood loss from other thing, I have to treat it also, and to help them to eat this healthy food we already mentioned about, and to take more food encouraging absorption of iron and vitamin B12. And follow up. We have to follow up our anemia. We start replacement, we have to follow. If we already in true track or no. Yeah, we have to follow with simple طبعا complete blood count to see hemoglobin. There is progression of hemoglobin. It's progressing or not, to see we are right for treatment or not.
Okay. So first of all, I want to ask all our viewers today and people who is watching us now, please, if you have any symptoms or any situation like you're facing, your relatives, please book an appointment with a doctor. You can book appointment with Dr. Rahab, and please just check and follow up, because as we can see, it's something serious in our life, which sometimes we're not paying attention to that, but it's very important. For it can be cause of any other disease we're having in our life. So please, you anytime can contact Medcare Hospital Sharjah or Medcare Hospital itself and book your appointment. Thank you so much. So I just want to mention that earlier we were speaking about cancer. As this month, October month, is for breast cancer for women. Awareness, yes. So maybe you can suggest something. And I have a question. In case if there is a situation, the women or the ladies who has to come and check, I think they have to check for anemia too, like to do full test and everything, right?
It's a simple test, as we mentioned. It's complete blood count. There is a lot of investigation for anemia. But first, we have to detect there is anemia by CBC, complete blood count. Your hemoglobin, it will be low. Actually, different from child to adult, from male to female. But at least we will mention that for male, at least from 14 to 18 milligram. And for female, from 12 to 16. So if we found it's low, we have to search for iron stores and for vitamin B12, for folate, and for other causes. That's a simple test. We can do it, because in cancer patient, it's chronic disease, they will have anemia and they will be at risk for anemia. Anemia, it's only we mentioned regarding symptoms.
Okay.
And we didn't mention about risk of anemia.
Okay,
It's very, because it's very, anemia, it's okay, simple, and we can manage, treat it if curable. It can cause many risk for your health. First, we can طبعا heart problem, because your heart need to pump more blood to overcome these low RBCs. And low oxygen also reach the blood, the cardiac muscle. So you may have heart failure, ischemic heart disease from anemia. So we have to take care. If blood loss more, we can at danger of death from sudden blood loss and hypovolemic shock. So we have to take care of our blood and our hemoglobin to treat anemia well, and not to ignore it.
It's beautiful. Actually, you're right in these things, and I heard before that you have to check your health, like make a full checkup at least 6 months to 1 year, once, twice, to see what's going on in your health, right?
Yeah, at least, as you mentioned, at least 6 monthly to check regarding your CBC, as you mentioned, complete blood count, to see what's your health going on, if there is any problem. It's important to not ignore ourselves.
Okay. If we are talking about like overweighting too, I mean that some people, they have, it's not just because they're eating a lot, or there is a health issue that people are overweighted, right? So is there any suggestions for them? Because sometimes we're eating a lot and we're not eating, but still we have
weight increasing.
Exactly, weight increasing factor.
Yeah. The main factor, we have to exclude thyroid. If there is problem in thyroid, hypothyroidism, it will cause weight gain easily, and we can't lose it. So it's easy to check our thyroid to see if there is a problem to manage our obesity. طبعا there is adrenal gland abnormality. Also it will cause weight gain without cause. And if we exclude organic causes, so we have to go for diet and exercise. But first, to exclude, if there is something we can treat it, it will be easy.
Okay. There was a question earlier that the person went to gym to just do simple exercise, and the trainer asked him to go and do full checkup of body for anemia, for everything. Then he can attend the gym and trainings. I think now all those, again, I'm coming back for our lifestyle, which is now very important in the situation where over the world, that we need to check up before to do anything which will relate or affect our health, our body, our even mental side of our lifestyle.
Because
right,
it's important. It's important, very important before you start training, because there is a little bit aggressive exercise. Actually, so it's better to check yourself before, because if there is any problem, it will affect you. Maybe you will develop anything serious during your training time. So you have to be careful. Especially we are talking about anemia. If you have anemia and you go for training, aggressive exercise, you will be dizzy, you will lose your consciousness. So it's easy to check ourselves before to go for training.
Doctor, just question we received in our Facebook page. Again, thank you very much for being active. Is there any machines to check your iron or anemia at home is existing, or it's questionable?
Difficult now. It's a dream for us.
Okay,
till now.
It's a very good point to pharmaceutical
because
to think about it.
Actually, iron should be طبعا test in blood in laboratory. No rapid test for iron at all. Still, I hope to be in process.
Okay. Earlier, I was asking a question, I think because we received again question, maybe it's similar to what we discussed. What will happen if anemia is not treated? We
already mentioned about risk of anemia.
I think it's related to risk.
Yeah, because risk of anemia we mentioned that may cause serious condition, especially for your heart, because it's deficient oxygen to all your tissue.
Okay.
This is very serious. You will develop this heart problem, lung problem. So we have to take care of anemia, as we mentioned before.
Okay. I think we can discuss earlier again. We discussed about the women, female.
Yeah.
Is there any type or differentiation between male and female treatments?
Different type, no, at all.
Okay.
Different type, it will be depend on the cause of anemia and type of anemia. But regarding male or female, it will be the same.
Okay. So it's
no, and only the different regarding hemoglobin we mentioned.
Yes.
For male, I want from 14 to 18, but for female, I want from 12 to 16.
Okay.
That's all. If I to normal range, it's okay for me. But regarding the different treatment, will depend on the type of anemia itself.
Okay.
Not on the gender.
Okay. Is there any medicine we can have at home, just in case if we're feeling like we mentioned it earlier about that? If we already. Tiredness. Yeah, if the patient already passed all the tests and everything, he got his treatments, things. But how long, example, the treatment?
It will take.
It will take the treatment of anemia itself and medication.
Usually, anemia itself, it will take according to the type, as we mentioned before.
Okay.
It's very important because it's a different management for every type.
Okay.
But at least 3 months. If vitamin deficient, at least 3 months. Then we will see, because we mentioned before that RBC's lifespan, it's 120 days.
Okay.
So we want to see 3 months at least, then we will decide according to the hemoglobin percentage.
Okay. There a question now regarding the vitamins, what we mentioned. Okay. Yes. There is a question about the vitamins in case if we're in any disease, health issues. Everything is going, doctors or pharmacies or we're ourselves, we're going and buying vitamins. Okay, I'm vitamin deficient and I need to, exactly. So as we mentioned for the iron, if we're using a lot of iron, is there any problem too?
Yeah.
Like, I mean that if we have deficiency, good. But if there's iron, okay, beautiful. Can
it's overdose for iron also.
Exactly, that's what I'm saying.
Yeah, it will cause this deposition of iron, a different tissue in our body actually. So we have to be careful about iron store in our body and iron level, ferritin level in our body. So we didn't take this randomly.
Okay.
We have to take doctor's opinion actually for iron replacement.
Beautiful.
And vitamin B12 also replacement, because we mentioned before that it's different. Maybe some people need oral replacement for vitamin B12 or injection if there is lack of absorption.
Okay, so for the group of vitamins and whatever we're having, it needs to be taken very careful and serious too. Yeah. Sometimes we're taking vitamin C, and there is it's in complex of vitamins, so the complex should be taken care.
Properly. All vitamins we have to take care.
Okay.
Because it's all chemicals also, and we need to be careful about it. Not regarding I will take it, not like this. It will affect our body if we didn't need it.
Okay, so anything what is overdosage or less dosage, it's affecting and not in proper way.
It's the same. Yeah.
Okay. I think I heard. In the pharmaceutical industry, we say that anything what we're having, the dosage is important, even in our food, even in anything, the dosage or how much we're using is very important.
Really.
So I think
because there is overdose and also deficiency. So overdose, it's a problem also. Like deficiency. So we have to take care about that. Okay. And we have to test ourselves and see we need it or not. Like also vitamin D. A lot of people take vitamin D like this. And if vitamin D more in our body, it will affect our kidney. And so it will be a problem.
Oh, actually. This is very important to mention that whatever we're using as a medication, or it can be natural or synthetic, it can affect the other, I think, organs of our body,
organs in our body, yes.
Okay, that's very good to point, because sometimes we're eating, we're having medicine, we're doing exercise, we're doing
overlap. Everything, it's middle, it's okay.
Okay, we need to check it always.
Yeah.
Okay, how long anemia that you need to keep the patient in the hospital to take care or protect?
For sure, a lot.
A lot.
A lot actually, because you mentioned about severity of the anemia.
Okay.
If mild to moderate, I can manage. But if severe anemia, need blood transfusions. A lot of types of anemia need blood transfusion actually. A lot of types of anemia, especially hemolytic anemia, destruction of RBCs, the genetic, like sickle cell anemia and spherocytosis, deficient of some genes, it will cause destruction of RBCs and sudden loss of your RBCs. It will cause sudden symptoms and severe symptoms, especially for maybe lead to death. So they need blood transfusions, they need admission, sometimes ICU admission, to follow the patient and to manage them.
Okay. I want to thank you, doctor, for today's session. It was really, really amazing. I want to thank all our viewers and everyone who was with us today. Thank you so much. And if you have any symptoms, I will repeat it one more time. Please book appointment with doctors and check your health, and stay safe and stay healthy. Doctor,
thank you. Thank you. Thank you to be with you today. I was happy actually. And as Hadea told you, if you have any symptoms, don't ignore yourself and book appointment.
Thank you so much. Have a nice day.